If you get a breast lift, would it reduce the size of natural breasts? Now that is not a straightforward one to answer. Okay, so the way to say this is not really, because we're not removing any breast tissue. We are removing some skin, but that's not a substantial amount of tissue, so you shouldn't really get much difference. But in some cases, you really can feel like you've got less breast tissue after an uplift. And the reason is, if you imagine, this is going to sound ever so glamorous, but imagine your breasts are a sock full of cotton wool. Bear with me. And if that sock full of cotton wool is kind of very loosely packed, and you were to then get the neck of the sock and scrunch it tighter to make it lovely firm and plumptuous breast, then the breast tissue is more densely packed in that skin and is occupying less volume. So you will feel smaller, but you'll be projecting more. And since projection is really a measure, so your cup size, in other words, is really a measure, your cup size is really a measure of projection. So you're actually projecting more, but there's less total volume, but it's denser. I mean, who knows? So no, we're not removing tissue, but you can have these feelings. If you've already got dense breast tissue and we're just hoiking it up, then you will experience very little volume change. So this can leave things as clear as mud for you. You can think, well, what the hell does that mean for me? Where do I stand in all this? What's going to happen in my case after an uplift? Those of you who tune in regularly know what I'm going to say here. What we do to give you the answer in what will happen to you specifically in your case is we tape your breasts. And when I say we tape your breasts, we don't buy some sort of Amazon tit tape, kind of like the Kardashians might wear on a posh night out with no bra. We tape your breasts using surgical tape in a manner that simulates the way I would do your surgery if I was doing your surgery. So I plan how much skin is going to be removed for your surgery, and for the taping, I invert that skin and tape it, and I do it at the lower part of the breast. So it really simulates quite similarly what will happen as a result of your uplift. It simulates how you will look for the first week. It doesn't simulate how you'll look a month later, although one or two people have gone home with it and have put a fairly good innings of wearing it for a month to sort of try and work out. I mean, I think the record is 3 weeks. It leaves your skin, I don't recommend that. I mean, a few days is fine, but it kind of makes your skin all kind of crusty, and you know, it's fine, there's no damage, but it's, there you go, whatever. So yeah, just come in and be taped, and that's it. That is what it will do with you. Another interesting aside, interesting for me, less interesting than cat videos. Another interesting aside is that if you're planning a breast implant and you have breast droop, then it is really, you know, then there are two things that are going to change, and you can't get your head around necessarily what what the outcome's going to be. So what I like to do is tape your breasts to simulate the uplift, and then we can plan the implants. Then we can use external sizes. Then I take photos, repeat photos with you taped up, and I run that through the 3D scanner thing, which creates a 3D model of your body, and you can apply simulations to that taped up appearance. And that's much more accurate. The simulator, the 3D simulator I use, which is called Chrysalix, many of us use that. The 3D simulator package can simulate an uplift, but I find it's much less helpful as a simulator when it's doing that. It's more an artist's impression, and you basically can do anything in Photoshop, so I don't really dig that. That's not very helpful for you as a sort of tool for seeing how you're going to look. So instead I tape, run it through the simulator, and then you can behave, you can interact with that simulation in exactly the same way as if you were just having a primary breast augmentation with no uplift. So that's really helpful. So yeah, there you go. Hannah says, thank you, that was helpful. You're so welcome. I'm glad it was helpful. I'm delighted.